welcome to #OurDocTalk with NorthBay Healthcare Chief Medical Officer Seth Kaufman. Today we're talking about COVID-19, the surge, and how to prevent the surge. And thank you, Dr. Kaufman, for being here.
Thanks for having me. Good morning, everybody.
So let's just start right off. If we're talking about a surge, can you tell us what the numbers are looking like in Solano County and at North Bay in terms of cases?
Sure, happy to do that. A reminder for everybody who's watching who I am. So as Robin stated, I'm the Chief Medical Officer here at North Bay. I'm also an emergency medicine physician, so I spend a lot of my time helping lead our organization. As an administrator, I'm also seeing patients in the emergency department. So I'll make sure everyone knows who I am, and thanks for being here. So we do like to start off with the numbers. Today we are going to talk about the surge. First, we're going to talk about the surge, and we're going to talk about the relaxation of the businesses and the restrictions in Solano County, and then have we seen a surge from that, and if so, what does it look like, and talk about that a little bit, and that's what today will be about. And of course, I'm always happy to answer your questions. So, in terms of numbers, as of yesterday, there was 559 cases in Solano County. The county has tested about 13,000 residents, people in Solano County, the vast majority being those with symptoms. So we have there is some testing available, but very little testing available for those without symptoms at all. The majority of those 13,000 are people who were at risk or possibly had symptoms. So, and our own Solano County numbers are good. We have in the last few weeks, and we will talk about that. In the last few weeks, have seen we saw a small spike of cases. This did not necessarily have an obvious trigger, but since then things have really improved, and we are neither seeing a significant number of cases on our hospital side of the organization, in our dedicated COVID unit, and we are not seeing a significant number of cases on our ambulatory side or our clinic side, and we do our testing in our urgent care clinic. That does reflect what our Solano County numbers look like also. So again, the Solano County continues to have a fairly flat epidemic curve. There's some days there's more cases, some days there's less cases, but overall it's a fairly flat epidemic curve, meaning we're not seeing a lot of cases in our county.
Okay. So after the Mother's Day weekend, we did see kind of an uptick. Are you concerned that as things open up and so forth, that we're going to see another surge?
Great question, Robin. So Robin's asking about, people are desperate to see each other, to have activities together. We did see a small spike after Mother's Day. Are we seeing more of that? And what is the relationship between these activities and the loosening of restrictions and cases in Solano County and at North Bay? I'll start by, telling you a little story. I have two children. I have a 10-year-old girl and a 12-year-old girl. And if you're anything like me, you are just desperate to find something to do with them. Or do with yourself if you don't have children, or do with your other family members. We are just desperate would love to get out, do more, feel safe doing it, and it's so challenging. And with school ending in the next week or two for most systems, we're nervous about the summer and how we're going to manage our children. So I'm sure many of you can relate to that today. So first I want to mention a little bit about what we're doing, what the county is doing in regards to businesses. And it is confusing. We put a link on the Facebook page today to the roadmap from the Solano County Public website. It's a nice overlay of the California stages and the Solano County risk levels. So look at that chart. It's the best way to understand how they overlap and what's happening in Solano County today. The most recent businesses to open are allowed to open with restrictions are our dine-in restaurants, our church. They're allowing church gatherings and other types of religious gatherings, and barbershops and hair salons with restrictions. Right. So the key is that these medium risk businesses have to create an environment that allows for social distancing. Mask wearing is mandatory. It's also mandatory at NorthBay Healthcare. We require everybody at NorthBay to wear masks whenever they're in our organization. So I want to make sure that everyone understood that. And the county continues to assess the safety of and the number of cases in the county, and is submitting requests to the state, talking with the state so that we can continue to open. So there is discussion about opening some more higher risk, medium risk businesses. And they're not allowed to open yet, but that's being discussed. These would fall under stage 3 for the state and medium risk for the county. And again, you can find that on the website. That's things like nail salons, for instance, is being discussed. I know that. And when that opens, I don't know. I don't know that answer, but I know it's being discussed, and it's all about keeping ourselves safe. So, from the Memorial Day activities, let's talk about Memorial Day activities. Did North Bay see a spike of cases? We were concerned we were going to. So I'm sure we all saw pictures of groups together, mostly outside, doing things together. And we, of course, saw that as a healthcare system and got concerned, like, are we going to see a spike of cases? Seeing the protests right now, also, we are concerned that we may see a spike of cases. Remember, there's an incubation period to this disease, and it's longer than the flu. So that means that if you get exposed and you're going to get exposed, the time to when you show symptoms, if you're going to show symptoms, could be 5-7 days later. So we thought, okay, it's Memorial Day weekend. Are we going to see a spike of cases in the hospital and in our urgent care a week later, the next weekend, for instance? And we did not see that. That was really reassuring. For those of you that don't know, we have a lot of amazing, great policies at North Bay to keep our patients safe. North Bay is a safe place. Our health systems are safe places to go. We have mandatory mask wearing, as I just said. Our hospital cases of COVID are isolated in a certain area of the hospital. We have really ample personal protective equipment, so all the masks and the gloves and the gowns. We have a good number. Anybody who needs it can use it, and we of course have really strong policies and compliance around hand hygiene and trying to distance ourselves as much as possible. So it's a very safe place to come. We've said it before. Other healthcare systems feel the same way. If you need care, you should come to North Bay, go see your doctor, reach out. It can be a virtual visit if it's on the clinic side. If it's the emergency room or more concerning symptoms or concerns, just know that you're safe here and that we're a safe place to come. So we did not see that spike of cases, and the question is why? And I don't have a great answer for that. I have my own hypotheses, and you can read also online about these things. But in general, one thought would be that it was a nice weekend, and data shows that there's not a lot of transmission outside. And so, Memorial Day weekend, people are out and about. Another thought is a picture I posted is that there's really smart policies out there and practices. So there's a photo posted on the Facebook page showing Dolores Park in San Francisco, and this is New York's doing it. A lot of the big parks are doing it. They set up 6-foot little outlines all over the park to space people out. That's a really smart policy and practice that keeps people safe, but allows them to be in somewhat of a cluster or to congregate and to be safe. So what's reassuring about that is that can we carefully and methodically continue to open our county and have smart policies and practices and not see a spike of cases. It's still too early to know. I wish I could just say yes to that, but I'll tell you that it's somewhat reassuring seeing some of these photos, seeing masks on people when they're outside and forced to be in kind of close contact, and the fact that at this stage we've seen quite a plateau of cases. That's all very reassuring. So that was a long answer, but an important one about these, whether we saw a spike in cases.
Couple of questions on those medium risk businesses reopening. Do you know how that's going to be monitored, and do you have any ideas on what they should be doing as they reopen?
Sure. Solano, this is all managed by Solano Public Health, and actually on there, it's open to the public on the website. Fairly easy to navigate. You can get to the pages describing exactly what businesses need to do to safely open. But the categories are generally things you completely would expect. Kind of restricting patrons so that you can social distance. Mandatory mask wearing is one of them. Things like hand hygiene. So the stuff we would expect is in there. We are one of the earlier counties to open, and that was along with other counties that are just not as urban. We obviously have very urban areas in Solano counties, and those areas, including where I am right now in Fairfield, saw higher levels of cases than others, as we would expect. There's more people. They're kind of, we're urban here, right? We're forced to be closer together. But we were really on track with other less urban counties and trying to open earlier because we are not seeing a spike of cases. We may in the future, we may tomorrow. Nobody can predict it. But there are pretty strict compliance restrictions, a lot of compliance being monitored by Solano Public Health. That could include spot checks and things like that. And I know from my conversations with our Solano Public Health, they are really going to be enforcing these restrictions. Enforcing these rules for to keep everybody safe.
So some people are afraid of takeout meals, let alone going out to dining.
Yeah.
What are your thoughts on that whole?
Sure. That's a good question. I think so. In terms of dining in, it is all a risk. It's hard to put a number on that. If I said to you, you're just as safe as going to a restaurant with other people in the restaurant as you are being at home, you would turn off your screen right now. Like, that just doesn't make any sense. If you're near people, there's always a risk. If, over and over again, we have, when we look at the cases that we've seen, and the county does, and so does NorthBay and others, do these contact investigations where we look at the person who's positive, who has COVID-19, and we trace whoever they touched. We see that the majority of new cases we're seeing are from clusters, and those clusters either fall into family contacts or congregate living facilities, which is that general term for things like nursing homes or other environments that people are forced to really be living together in close quarters. Nursing homes being the most concerning because it's a vulnerable population. And or in some situations, but less common, is in work environments where you're very close together. So I think going to a dine-in restaurant remains a risk. Takeout is much less of a risk. In that situation, if everybody's wearing masks, then I think receiving takeout is much less of a risk. There's not data that I'm aware of showing that if you eat food that has that we're getting the disease by eating food that possibly has coronavirus on there. I've never seen anything involving that. Of course, you are touching something someone else touched, and could it be on that bag? The key is just good hand hygiene. So washing your hands, using Purell. So takeout, I think, is fairly safe. Dine-in restaurants, we're just the beginning of our restaurants opening. I want them to be able to open safely. I want them to be able to businesses to be able to get going again. I think we have to wait and see how that turns out.
Okay. So what are the signs of a surge we're watching for? What has NorthBay done to prepare for a potential surge? And how does somebody coming to the hospital know they're not going to run into somebody in our hospitals who has COVID? Sure.
So that's a great question, and I'll just add on to some of the stuff I said a little earlier around how we're prepared at NorthBay and that it's safe to come to NorthBay. In addition to everything I mentioned around hand hygiene and mask wearing and ample, personal protective equipment, so PPE, we and other health systems too have really robust surge policies. These policies cover things like, what do we do if we reach a limit in the number of beds available in our intensive care unit? What unit would we open next? What teams of doctors and nurses would be caring for our patients? How would we be monitoring equipment and supplies? How would we route patients through our hospital? So these are things that we've practiced and are robust, and you should feel safe. That if we are not at that stage at all where we are in a surge situation, but we have a way to organize our leadership, organize our staff, organize our hospital units, and to be ready for any sort of increase in cases. With that, I think the question about, like, I come to North Bay, am I going to pass somebody in the hallway who has COVID? First thing to know is we have a very restrictive visitor policy, and if you are a family or close friend or somebody related to a patient here, and you've tried to come and visit, I'm sure it was really frustrating. It would feel frustrating to me if I had a family member in the hospital and I was told I could not come and visit them. It's really to keep everybody safe. So we have a very restrictive visitor policy. We just don't have anyone but staff and the patients in our hospital right now in most situations. There are very few exceptions. So if you are a patient here, you will not be anywhere near our COVID patients. We isolate them in a certain area of the hospital, and our COVID patients are safe, and our staff are dedicated to those units and are taking care of them, and wear personal protective equipment. And the rest of patients are in other areas of the hospital. We have specialized cleaning system that includes a UV light system that completely cleans rooms, so you never have to worry if you're coming to get care, or you're with your family member, and let's say you're in the emergency room. Hey, if someone had COVID before me, and is there now COVID in this room? And the answer is no. It's been cleaned, and these are well-established cleaning techniques that will not allow transmission of COVID.
Okay. So if you're an otherwise healthy person, how worried should you be about getting COVID-19, and who's at risk?
Good question. So who's at risk for getting COVID-19? And you're a healthy person out there, do you have to be concerned at all? We are not out of the woods with COVID. We're not even close. We're going to be living with this for quite a while. If we get a vaccine in a year, which would be the quickest a vaccine has ever come to market, maybe we'll be able to manage an effective vaccine. Hopefully, be able to manage this even quicker. But COVID will be living with us for quite a while, and if that was hard to hear, I'm sorry. It's going to be. Does that mean we're going to have spikes all the time, or these restrictions? It doesn't. We're going to reach a new normal with some level of safety policies that keep us all safe, but allow us to leave our homes and go do things with our children before we go mad, right? So the answer to the question is that if you're healthy, you're a healthy person, I don't want anyone to be scared, but you should remain diligent about, hand hygiene, mask wearing, and social distancing, because you are at risk of getting COVID. And we are seeing a good number of healthy young people with severe COVID illness. We are seeing it. It doesn't mean because you're more susceptible, a healthy person, more susceptible than others, and we'll talk about that in a second. It could be a lot of reasons for that. One could just be that generally healthy, functional people are out and about or are going to work. Maybe they're essential workers more than, on average, older people with illness. So it could be that we're just seeing more young, healthy people because they are exposed more to the disease because you're out and about doing things. So no, I don't want you to be scared. I just want you to be diligent. And the vast majority of people who do get COVID do just fine through it. But there's still people who get very ill, and that includes younger, healthier people. But younger, healthier people are not the highest risk. The highest risks are older age in terms of having severe illness and being immunocompromised, having diseases that suppress your immune system, diabetes, cancer, things like that. Heart disease has been shown to be a risk factor. So those people are even more concerning. On that note, I received good questions this week about church gatherings or, religious gatherings and how safe they are. And the first place I go is that a lot of those gatherings involve a good number of older patrons on average. And maybe that's not your congregation, but many have, in general, an older population that attend those with younger. So the first place I go with the idea of a church gathering is that does concern me, is that that's a population at risk for severe COVID illness, and here's a situation where it's going to be a group together. That, of course, has to be balanced with the importance of a community coming together, praying together, being together, especially right now where there's so many challenges and so much happening. So I recognize how important it is for people to have each other, beyond a Zoom screen, but also we have to recognize that people who have diabetes, who are immunosuppressed, who are older, are going to be at risk for having severe COVID illness.
So I've seen this conversation a lot online when people argue about wearing a mask. Is a mask protecting you from others or protecting others from you?
Yeah, so there's no definitive conclusions around this, and there is some controversy around mask wearing. I believe it is an important intervention, an important practice that will help you in the event that you get COVID from spreading it to others. Maybe there's some theories out there that you're also not touching your hands to your mouth and nose where that's how COVID gains access to your body. Maybe there's a little less of that. I'll tell you, for me in practice, gosh, I feel like I touch my face a lot when I'm wearing my mask because I'm readjusting it gets uncomfortable. So I'm not sure that's true, but right now the position, and I agree with it, the position of our CDC and others is that it's minimizing you spreading it to others. So it's a public health mandate, because you're really doing you're doing what you can to avoid you spreading it to others. Often what goes with that question is, but I don't feel anything. I don't have a cough. I feel healthy and fine. So why would I be worried about spreading it to others? And that goes to a very difficult conversation around this concept of asymptomatic viral shedding. Asymptomatic meaning I don't have symptoms. Viral shedding meaning am I spreading virus? And that is always a concern. The biggest concern is that you're most infectious with COVID-19 approximately a day before, maybe a little before that, or right when you start having symptoms. That's how this disease is spreading so quickly. It's also fairly, it's a little more contagious, or maybe more than that, than flu. It is not as contagious as a lot of the airborne illnesses we see, like TB, but the biggest cause probably for the rapid spread of this disease, or one of the biggest factors, is that you're most contagious, whether you have barely any symptoms or not, before you even know you have it. That's why mask wearing is so important. That's why, because if you don't know you have it, maybe you get a cough 2 days later, everywhere you were at, that you were walking around talking to people in close quarters, you were spreading the disease. So that's why the mask wearing is so important, so you don't give it to others.
So even talking is a concern for spread of the disease.
It is.
Talking close to someone. It is.
Talking close to somebody is a concern. Some examples: the choir group that all got infected is a good example. Again, that was close quarters, indoors. So, but yes, talking would be a concern.
Okay. People still compare death rates of COVID to the flu. So, which one is worse?
Which one is worse? That's a good question. Remember, in a bad year, we might have 60 or 80,000 deaths from flu. Right now, what we see with COVID is higher numbers, and COVID does have a higher death toll, both by whole numbers because of how quickly it's spreading, and also even if the same amount of people who got the flu got COVID, there's still a higher death rate. So by a lot. Now, flu might be 0.1 or 0.2% death rate, and COVID's 1% more depending on the environment. A lot higher in certain countries and areas, and then lower in certain areas. So that's a 5-fold or more, 7-fold increase in deaths. So COVID does kill more, even though the numbers are on the low side. But when you're talking about a pandemic and the exposure worldwide, as you know from the numbers, it's a lot of people that are at risk.
So can you talk about the potential problems with the resurgence of COVID in the fall at the same time that the flu season arrives?
Sure. So we don't know if it's going to happen, right? So we'll see. Most experts are projecting that there will be another spike as we continue to loosen criteria. We'll see another spike in fall, and flu comes in around late fall and into winter, depending on the area. And will we see those on top of each other? By the way, as a side story, the minute we went into shelter in place, flu also went away. So our hospital system ready, and all hospital systems getting ready for a flu season. When COVID hit, all of a sudden we didn't really see flu anymore either, because flu spreads pretty similarly to COVID. And so, it's a droplet precaution disease. So, hey, if you're shelter in place in your home and you're keeping 6 feet away from people, you ain't going to get COVID and you ain't going to get the flu either. So those will go hand in hand likely. And we'll be able to manage both. But we'll be ready with those surge policies I talked about earlier. And we talked to our other health systems in our county. We'll be ready for a flu season. We'll be ready for if COVID becomes a normal seasonal viral infection also. We'll be ready for both those spikes. We are ready at all times.
Okay. Well, how are you going to know if a patient coming into the ED has typical flu or COVID, and what's the risk? What's the challenge for the ED staff?
Oh, sure. So they do look a little bit different. They look different on X-ray and CAT scan. They look different. There is a little bit of a difference in terms of some of the symptom lists. So we're getting very good at COVID. We know flu really well. We will be able to tell them apart, often probably without testing, but we're always going to have testing. We have effective flu tests. We are continuing to improve our COVID testing. So by the time we have a flu and COVID season spike together, if that happens, and I hope it doesn't, we'll be able to tell it apart by symptoms and the exam and things like that. And then testing will help also.
Okay. If you contract this virus and you get better, can you get it again?
Oh man, that's a good question. I wish I could just tell you you're never going to get it again if you have it once. Over and over again, our epidemiologists, our infectious disease experts, Dr. Fauci, everybody, they try their best. The answer is we don't know. We don't know immunity. That's the question. That's the issue, is that we can see that people have antibodies after they get the disease, but do those antibodies confer immunity? And it's just too early to tell. And that of course leaves the question, is this going to become a normal seasonal viral infection like the flu, where we'll see little spikes here and there or bigger spikes, or will, either because of a vaccine or natural immunity, will at some point it go away? And I don't know that answer, but the minute I do know that answer, I will hop on the screen and tell you. I don't know that answer at this stage. Oh, that's what I want to say. But I will say that what we're seeing there, the stories around whether there'll be herd immunity have kind of died down, and that's because we're just not seeing that. And it's too early to know completely, but there isn't a high enough prevalence to know whether a community, if they're exposed enough, is the whole community now guarded against whether getting it again, or the people who never really had it there, are they not going to get it? That's what herd immunity is that if enough people get immune from it because they get vaccinated or they actually get the disease, is everybody protected in that area? And we just don't know that yet. We don't know that. Also, herd immunity levels for this disease are going to require at least 60, 70, 80% of people to be exposed. And we don't know real prevalence numbers, but it definitely is not that high. High, we think about 3-5%. So, and Solano County is probably in the 1-2% range at best, and that's all just estimates. Don't think those are real numbers. We don't know completely. That'll require more testing.
Okay. So if somebody has a senior friend, you've talked about seniors being more at risk, what can they do to help protect that senior and take care of them?
Yep. So that's a good question, and something we're going to talk about more next week when we talk about how to care for senior citizens. So I'll just tell you that that's one of the more difficult conversations I have with caregivers who are like my family member or whoever I'm taking care of. How do I need to care for them? They need me for their health, and the answer is absolutely diligent hand washing and mask wearing, and doing your best to minimize unnecessary interactions. That's the key right now, are doing those things, and we'll talk about it more next week. So on that, I hope you'll join us next week as we talk about the care of senior citizens during the COVID-19 outbreak. You can find all of my chats on northbay.org /COVID chat. So thank you for joining.
Thank you, Dr. Kaufman, and we'll see you next Thursday at 10 a.m.